Life Healthcare was previously known as Afrox Health and relisted on the JSE in June 2010.
Right, so this one is an emerging markets hospital operator because in addition to South Africa, they've also been expanding, buying businesses, stakes, some of them controlled, some of them otherwise, in India and in Poland. I suppose Poland is an emerging market, maybe? Yeah.
In Europe?
Developed country? Don't know.
Well, I'll leave that to you to decide. But the difference here is the emerging market versus the developed market, and whether that is a more attractive environment. And going with what you're saying, if you're looking at getting richer when you're older, that probably is a developed market trend.
Yeah, so there's more growth. But to put the scale in perspective, remember Netcare 54 billion, this one is 40 billion.
40 billion, PE of 21.8, and a dividend yield here of 3.8%.
Which is about the same, right? But just a little smaller. Fell off the bus a little bit. Share price will reveal that it grew very, very well since the listing in 2010.
Well, there we go. Let's go straight into the share price.
Yeah.
And then it's been going pretty much sideways, down and then sideways.
So what's that about, Joseph?
Joseph?
Well, it's basically almost saying, you know, I've gone as high as I can, because if you look in terms of the trend where it balloons, certainly it's a little bit longer on the downward trend. I think Paul is correct. You know, this is predominantly, obviously, it's a new entry into the market. Poland is a developing market, and India. There will be pressures. I'm not quite sure when our national health insurance is going to come into South Africa, and what will be the impact in terms of shaking, obviously, the industry. We had the stock.
You say you're not sure when NHI will come in, national health insurance. Do you think it is a dead certain that it will come in?
I think the government does not have the stamina to motivate its entry, because remember, the industry was a little bit of nervous to say, no, we need clarity in terms of what they want to do. So government has been tossing with a lot of policies, but certainly they're also not delivering in terms of the government hospitals or public hospitals. So there will be pressure if they can get their act together in terms of the private public hospitals. Possibly, you know, there will be room for them to be able to advance that. But you know, to try and copy the UK model in terms of that, it might be very difficult, because you know, we're different country in terms of social dynamics.
Look, I think what's going to happen over the years ahead is that the state hospitals will remain the state hospitals. They'll become more and more ineffective. The state will pay to have bed nights on their tab at the private hospitals. That's similar to what happens in the UK. They may at some point concede defeat and start doing public-private partnerships where private groups like Netcare get the deal to manage Baragwanath or something. But of course that would be very firmly opposed by the trade unions. NHI will just be a little bit more money being spent and a bit more of an initiative to try and get people to have private insurance. But I don't think there's going to be a wholesale big ticket NHI with a massive increase in VAT and so on, because it's politically unsaleable. So I think you can not ignore that stuff, but don't regard it as a reason not to own the stocks, is my summary.
But again, it comes down to choice. How much hospital exposure do you want in your portfolio? And if you are stacking Life Healthcare Group against Mediclinic and Netcare, is there a choice to be made? Does Life Healthcare feature in that discussion?
No, it won't feature, because if you look in terms of versus Mediclinic, it does give you a very well diversified portfolio, and also you're having a little bit of foreign currency. The same with the Netcare. Certainly from its footprint in South Africa, it dominates. So if you don't want to have a highly diversified portfolio, you wouldn't have a Life Healthcare.
Well, do you agree with
I quite
Joseph's
like it.
call
Look,
there? You like everything.
It's true. Yeah,
today,
well, certain sectors I like a lot and others I don't. This is under new management. Andre Meyer, he was from, what's the second biggest medical aid? Not Discovery, the other one. Medi whatever. No, not Mediclinic.
MedScheme,
exactly. 5 points to you. So Andre Meyer was at MedScheme, and now he has joined Life Healthcare as the CEO. So he knows a lot about how to get money out of those people and so on and so forth. I think it's going to continue to do well.
Hot or not, Joseph?
Not hot.
Paul, hot or not?
I'll give it the hot. I like it.